Okay, I say let's kickstart this and some others will join us as we go. So hi everyone again, thanks for joining us this afternoon for our panel event about mental health. My name is Maya Ilani, I work in Communities Politics and Research team, and my colleague Anna, who's also on the call, will be joining us today. So thanks again for joining us, and thanks to our brilliant panelists who I will introduce in a moment. But just to say a few words about why we wanted to organize this mental health webinar. So despite the fact that there's a small delay, we all know COVID restrictions are about to come to an end and to be eased at least, and we're all going to return to normal and are expected to live as if the last 18 months didn't happen, as if we didn't experience stress, grief, uncertainty, as if all of those feelings could just disappear and have no impact on us whatsoever. We know it doesn't work like that. And that all of us will have to continue deal with the consequences of the pandemic for quite some time. And this also includes the impact on our mental health. In fact, many issues that have a huge impact on our mental health well-being, from bad working conditions, poverty, bad housing, all of this stuff has actually gotten worse. So in community, it is clear for us that mental health is a trade union issue and that we should be campaigning and working on this. It should be prioritized in the workplace, and we know that in workplaces that do prioritize mental health, the workforce suffer from less mental ill health. Despite this, it's quite rare in workplaces in the UK to address this properly. In fact, only 13% of line managers receive proper training to support those with mental ill health within the workplace. And we are still seeing, sadly, that those who are brave enough to come forward to talk about issues surrounding their mental health, they are being disciplined, dismissed, demoted. This is just not good enough, and it has to be stopped. The mental health of our members, their families, their communities, their colleagues has always been a priority for us before the pandemic, during, and now that we're coming out of it as well. We've been campaigning about this issue in the workplace. We also delivered training to hundreds of union reps, so they will have a better understanding of mental health issues, and we worked with employers to create good mental health policies in the workplace. Of course, that's not enough, but that's some of the stuff that we've been doing. Events like these conversations we're about to have is also important, we believe, to break down some barriers that sadly still exist when talking about these issues. And because of all of this, I'm really delighted to be joined today by our wonderful speakers to talk about all these issues and more. So first we have Dr. Rosanna Aline Khan. Hi, she's a Labour MP for Tooting and a Shadow Cabinet Minister for Mental Health. She's also an A&E doctor, so she knows her stuff when it comes to health and mental health. And she's joining us again after last year. She also spoke at our mental health webinar. We're also joined by two brilliant community members. We've got Bob Tompkins, who works as a prison custody officer in the justice sector. Hi, Bob.
Good afternoon.
Hi. And we also have Stephanie who's a self-employed, Stephanie Shuttleworth, who's one of our self-employed member and is the founder of MASH Marketers. We'll hear about your jobs more in just now. But before we start properly, just some housekeeping rules. We'll have a few questions for our speakers, and then we'll open up the debate for everyone. So please use the chat box to pop any questions you may have for our speakers. So our first question that goes to all our speakers is, can you describe your work before the pandemic and how it changed during the pandemic? So Bob, would you be happy to start this conversation with us and tell us a bit about your work before and during the pandemic?
Yes, I'll give it my best shot. Good afternoon, team. As I was introduced, Bob Tompkins. I'm a prisoner custody officer at HMP Forest Bank. I am a badged officer, but I'm also the health and safety assistant, which, as you can imagine, both of them together has led to rather a challenging time within the last 18 months or so. Prior to the pandemic hitting us in March last year, we were a normal prison working environment. Normal regimes went on. The residents got up, they went to the gymnasium, they went to work, went to education. They attended visits in our visits hall where they were greeted by family, friends, etc., husbands, wives, mums and dads, and everything was pretty good, really calm. Violence and such like was pretty down the list. Compared to our comparators in the sector, we are still the lowest with regards to assaults on staff, but unfortunately it has gone up due to the mental health instability, if I may use that word, and please correct me if I'm wrong, amongst the residents. Obviously, when COVID hit, things changed dramatically, not just for the residents, but for our members and non-members. I support them all. The residents became locked up, the term, 22 hours a day, and it became quite fraught. We've had to change the way that they are fed, the way we get them out for showering facilities, the phones and such like, and it really has had a big impact on my colleagues and everyone around us. But it is getting better. There's no doubt about it. Yes, a slight setback with the thing what Boris has decided now for another month. But as we're all saying at Forest Bank, we'll get there in the end.
Thanks for this, Robert. I'm sure we'll hear more about your work today and the stresses you are under. Steph, would you like to go next and tell us a bit about your work before and how it changed during the pandemic?
Yeah, so mine is very arguably much lower stakes than Bob's. I run a small brewery and hospitality marketing company. So we do things like copywriting, consultancy, and social media management. We pretty much specialize in breweries more than hospitality and small businesses. So sometimes they're called microbreweries, but now more often they're called craft breweries. And yeah, before the pandemic, like everything was going really, really well. We were a small business. There was just me and one contractor. Then I took on the first member of staff on the 17th of March, 2020. Yeah, I didn't expect that my becoming an employer would be an absolute test of everything because I didn't think the world was about to shut down. Yeah, I think it was hired him on the 27th. Then I think the pub shut on the 20th. Then it was my 29th birthday on the 21st. So I was 28 when all this started and now I'm 30, which I think is grossly unfair. Yeah, so we had an office. We were going visiting clients all around the UK. We're doing one of the best things about my business, which is to get new business leads and meet people. You have to go to a lot of beer festivals, which is really difficult, like I must say. But after the pandemic, the pub shut like with no warning, and we are a part of a forgotten about supply chain. So you would think that anybody who had any idea how pubs work would imagine that the beer itself is made somewhere and doesn't just pop into existence when it starts to come out of the tap. But that didn't seem to be the case. So they definitely weren't thinking about like the marketing contractors to the breweries and all of those things. So we had to shut the office, couldn't go and see, which we've now got rid of because we don't need it and it was a cost that we couldn't afford. I've been working in the house since the 19th of March, which is really difficult to run a company that's working with people across the UK from the spare bedroom, and our actual bedroom is next door, so you just walk around. It's quite like stifling. We had contracts that were cut short, contracts that were cancelled, like new work, had to offer discounts to clients because they were having massive reduced turnover as well. And one of the weirdest things is the guy that I hired on the 17th of March, he's doing really good. Hello, Tom, if you're watching. I've met him 3 times in my life and he's been working with me for a year and a half now, which is must be really difficult for him as well. But how I manage like my mental health as a person and make sure he's okay whilst only being able to be in a room with him twice since I've hired him, it's just not workable. Yeah.
Thanks for sharing that and that unique perspective, Steph. Rosanna, I guess when this question comes to you, there are two works that we should take into account in Parliament and as an A&E doctor. So would love to hear about your experience.
Thank you. And it's fantastic to follow Steph and Bob and to hear about their experiences, and just hats off to you. You've been working through incredibly challenging times, as have so many community members. So thanks very much for having me here today. Gosh, I mean, nobody expected the world to change in quite the way it did. And it was quite bonkers, really, wasn't it? And being a shadow minister for mental health, every day is different, much like being an A&E doctor. But we went from sort of going from meeting to debate and all sorts of things to suddenly everything being virtual, and trying to manage that at home while homeschooling a 5-year-old and a 6-year-old was something that probably many people can actually relate to. It felt impossible to be a good mum. It felt very difficult to to do the job that I am genetically built to do, which is to stand up to the government, and everything changing to be a virtual environment. Took some adjustment, but got there in the end, and it made it actually made it really interesting, because albeit very different to sort of have meetings virtually, it enabled me still to visit other parts of the country and engage with people in a way that I hope we can take forward after everything settles down, to realize that there are things that we can do digitally that means that we don't have to travel as much, that we can reach the harder to reach places. Though obviously I am a hugger and I love a good cup of tea, so not being around people was obviously very difficult for me, but in the A&E department was probably where things changed for me the most. And I've never stopped being a doctor, but I upped the number of shifts that I did and was working flat out, and got quite down actually, just seeing the scale of death that there was, and not being able to give comfort to patients and their families in the way that I normally would, dressed from head to toe in PPE once it finally arrived. But before it did, being absolutely crippled with fear, like many of my colleagues, many of whom paid the ultimate price with their lives in not being protected, but had the ultimate fear of coming home and giving COVID to my family. And so it suddenly became a bit of a survival mechanism, really. How do I stand up for my constituents, which I was so proud to continue doing and was able to do, but thinking outside the box, how to set up community initiatives to support people, how to engage people that wanted to help, while not physically being able to be in communication with people, how to do my shadow cabinet role, how to be a mum, all these normal things, the normal jobs don't go away, and all while trying to, save as many lives as possible, support my team at work, and see people at work really suffering with their own mental health. So there have been significant challenges, actually, but I'd like to, thank Community Union for all the support that you've always given me over the last, sort of 15 months or so, just in, how supportive you've been in inviting me to talk about the experiences and to share with you and the feedback that I've got from your members. So yeah, thank you very much. I'm looking forward to the rest of the discussion.
Thanks for this. That was really interesting, and a very kind of diverse experiences from those who had to carry on going into work physically, the challenges of suddenly working from home. My next question, and I'll start with you, Bob, again, but my next question for everyone is, obviously, you've described now quite a lot of challenges and causes of stress that impacted your mental well-being. And I wondered if you developed any coping mechanisms or any tips that you can share with everyone else on the call of how to deal with all of these. So Bob, would you like to go first?
Yep, I'm off mute. Yes, we've got the quick background. We are a Cat B local prison, 1,449 residents. But as you can appreciate, we are not just a prison officer, we are a counsellor, we are a doctor, we are a medic, we are a mum, we are a dad, and it all takes its toll. But what we have done at Forest Bank is initially, and one of the good things, and I must say that the union were fully behind it and assisted, when we come into the prison, we put up quite a large, in fact, a very large display board on everything that was available for our staff. This included the talk, TALK, where our members could phone up and discuss any concerns that they've got. We also, or I ensured that I had, with the blessing of the director and my manager, the health and safety manager, an open door policy. Obviously, I've got my day-to-day job to do, but I've still got it, an open door policy where managers or staff can come and speak to us. The support is definitely there. We have provided so much PPE, it's absolutely unbelievable, which of course that will alleviate some of the worries that our staff have got. Am I going into such an area? Do I need a mask? Do I need a visor? Pretty much like the doctor, quite a few of our staff would dress there like something from ET. You know, with each individual area had its own challenges. We still needed staff working in, we think, kitchens, healthcare. They're all still there. They are still needed. But what we have noticed, and I shouldn't say I'm grateful for COVID because I'm not, but from some of the positives that it has brought within the prison is the support from our HRBPs, not just at local level, but at the very top level. Again, open door policies, support in case of bereavements, and like everybody else on this call today, we know someone, and I hope not, we've had someone pass away because of COVID. Managers have actually dug deep, and they are going around and talking to the members. I'm not saying they didn't before, they did, but now it's become imperative that at least once a day, whilst that manager is on shift, he will go around to every officer on his house block, and there could be 6, there could be 8, and make sure they have a positive conversation with them. And that's one thing that I am grateful for. We've also upped our challenge with mental health first aid. I'm the instructor here at Forest Bank. I think there's only about 3 of us within Sodexo. And I've been given the time for that. So people are becoming, they won't diagnose problems, but they certainly learn how to cope with it and how to identify, not just in the colleagues, but in with themselves. On a personal note, if I may, I'm sure he won't mind. My son is a senior officer here at Forest Bank, and he's currently off with mental health issues. I'm going to have to be a bit harsh on him because he didn't take up the assistance that was there, like talking. I'm his dad, he won't. But there is still plenty of people he can talk to there. There are people he can phone, like this employee assistance program. They are being used. There's no doubt about it. But in my mind, they're not being used enough.
Thanks for this, Bob. Steph, same question to you. Any coping mechanisms or tips that you can share with everyone?
No, it's terrible. I'm just very stressed. No, I'm kidding. Yeah, like the normal stuff, like I've discovered I like gardening, going on walks with the dogs, but I am also very aware that like I'm lucky that I can do that because a few months before the pandemic, I became a first-time home owner. I'd rented previous to that, and had I lived in any of the other rented places, I wouldn't have had a garden to be able to do stuff. I moved to like the semi-rural part of Greater Manchester, so I'm able to do that now, and it's been really useful for me. It's really helped my mental health to just be able to leave the house and go and do things. But I know that not everyone is able to do that. I briefly had a croissant obsession. I spent about 6 months getting really good at making croissants. So that was a thing that I could do from working from home, because there was nobody there watching to see what you were doing. I could be doing a bit of work, then doing another fold. That's how you make croissants. You fold butter into it and roll it out. But it shouldn't be about learning new skills, but I did pick up that new skill. Put a little picture on my desk that says you're doing really well given the circumstances. It sounds silly, but I look at it and sometimes it does help. Sometimes it very much doesn't. But then I guess like one of the most practical things was I've just tried not to plan too far ahead financially, because with the business, I've not been able to do it, even with the self-employed support grant. I think that's the full name for it. I've been able to plan a little bit more to know that we'll be okay for say like 2 to 3 months. But when you're doing business planning, you're supposed to do like at least 6 months, and it's just absolutely not possible. I've no way of knowing how to do it. I don't know if I'll be able to like pay my mortgage within like 3 months. So ignoring that, I mean, that doesn't sound like a necessarily very healthy thing to do, but I guess like giving yourself like compartmentalizing little bits of chunks of time and being like, we'll be okay for this bit, and then we'll deal with the next bit as it keeps coming, that sort of thing. But being self-employed on my own, I have the union that I can speak to, and there are charities to speak to as well, but it is really difficult when you're on your own, because you're expected to be your own boss, you're expected to be your own HR department, you're expected to be your own training department. And when you as a person are going through a pandemic, it's really difficult to then be like, no, you need to check in with yourself and make sure you're okay. It's very difficult, but walk your dogs and bake something, I guess.
All good, solid tips. Rosanna, anything that you'd like to share with everyone about kind of coping mechanisms that you found during the pandemic?
Yeah, so much like Steph's croissant obsession, I decided I was going to try to get to grips with Reese Witherspoon's green smoothie, which worked with various levels of success, and I decided it was actually too much hard work, and it was better just to eat a banana if I wanted to be healthy. But all jokes aside, I learned the importance of taking the pressure off, because I think so many of us can identify with feeling like we had to get a certain amount done within a day, or for those with children, like we were failing them if we hadn't done all of the homeschooling worksheets, or for me it was just accepting that it was all right to feel sad and to cry, because I'd broken people's hearts in the hospital like the day before, and just it was a process, but it took time to get to a point where I could just say, Rosanna, just go easy on yourself today. Today doesn't have to be as good as it was yesterday or the day before, and it might be better tomorrow, but it's okay to have a bad day and not to feel okay. And that was a bit of a journey, because I think particularly when you're used to having lots of people that you support and you're there for and that looks to you for support, we can put a brave face on it. But I think I really understood the importance of saying, I don't feel okay today, and that's all right. And that when I was dishing out advice about, oh yeah, go for a run, or go out and go for a walk or play your favorite song, for some people it was all they could do to roll out of bed and not wear the same set of clothes for 5 days in a row. And I was asked to speak a lot on all of these positive mental health things that you could do for yourself. And yes, there were some that I adopted. I mean, I hate running. I love all sports. I'm good at sport, but I hated running. I was the one that would be tired. I could play a football match, 90 minutes, and not break a sweat. If I was running, after 1 kilometer, I'd think I was dying because I was bored. But I would convince myself, this is the worst thing ever. But I realized pretty quickly that exercise was going to be the thing that would help me. And a friend of mine and I, we started like going very easy on ourselves, walking and then running and then getting up to running 5K 3 times a week. And I remember I was getting asked to, you know, talk about positive mental health tips in magazines and on calls like this. And I would sit there and I would say, yes, and, you know, running is really great. And what's your favorite TV program? But you know what? The thing that resonated with most people when they wrote to me afterwards or got in contact or sent me an email, they'd be like, thank you for saying that it's okay not to be perfect and not to feel perfect. That was the most important thing. And I went from telling myself that I was a terrible mother whose children were going to have no life prospects because I was so terrible at homeschooling and holding down my job, into saying, do you know what? If my kids are happy at the end of this and I can stay happy for them so that their experience of this isn't going to be, you know, a grumpy, unhappy mummy when she's at home, then I've done my job and that's okay. And just removing all of the guilt and the pressure like from ourselves is so emancipating. You know, it is all right to have a crap day and accept that. And I think that is the best bit of advice. And if you're wearing your same jogging bottoms 4 days in a row, consider changing them. But if you can't bear to that day, that's all right as well. And that's the honest truth.
Thanks for that. I think it's really important also that we remember that all these kind of tips, while they might be useful, we in no way think that with the situation we've all experienced in the past 18 months, it was up to us to make ourselves feel good. A lot of it is completely out of our control, which is also a cause of stress in itself, that our life is not in our control. We in community try to do our best to campaign, support and shout for our members and make sure that whatever is in the government's control or their employer's control is done to improve the situation. But yes, it was completely unprecedented. Now I've got a personal question for Bob and Steph and Rosanna, but I'll start with Bob. Were there any particular challenges that impacted you yourself personally, or maybe one of your colleagues in the justice sector, that you think that people that don't work in the sector, that are outside of it, don't appreciate or might not be aware of?
Yeah, as I said, even though I'm still an officer, Maya, 99% of my time I'm on the health and safety role. Personally, what really got me down was the lack of understanding from my colleagues. They knew that on certain house blocks they had to wear full PPE, which was absolutely everything: visors, masks, gloves, etc. And they wouldn't, and that really got me down. Having to constantly go around, I may just be going up to the staff canteen to collect some lunch, and I'd see a cohort of 3 or 4 of my colleagues stood, and you couldn't get a person in between them, and you'd have to keep telling them, guys, come on, social distancing. And even to this day, that is still going on. I had to do it this morning when I saw an officer, and as I like the doctor, I'm very tactile. I also like a brew. I like a cuddle, shake hands. Hello, how you doing? We've got to wait. But this is it's a real bugbear at the moment within the environment. Some of the things that are affecting my colleagues are caused not through themselves, but through residents and what is actually going on in the world today. If you can imagine, if you would, just for a moment, please, you come to a door, a young man's behind the door and he's crying. He hasn't seen his parents, he hasn't seen his partner, his wife, his children for weeks upon weeks. And it's up to me and my colleagues to explain why. We are getting over that now. There's no doubt about it. We've introduced something called purple visits, where the resident, the homeowner, whoever can go down to our visits department, and he's given like a tablet, and he dials through to speak to his family or whoever at the time. We also have, and I do apologise, I can't think of the correct term, but it's like a special visit where if something's happened outside and it's deemed necessary to speak to the resident, unfortunately, if you are bereavements, that go on side as well. And all these take their toll. I misinterpreted the last question with coping strategies. I said what we're doing here at the prison, which is a lot and is very good. Quickly on a personal note, so I'm not taking other people's time, I've suddenly become a bit of a carpenter, and bits of wood I'm turning into bird tables, much to the disgust of my partner, because then I'll go and screw them on the fence outside. But that's one of my main coping strategies. I could never make a croissant, not a chance. But I can certainly turn bits of wood into something usable. But with regards to the work, that's how it is at the moment.
It sounds very tough, and I think I speak for all of us on this call that we can't even start to imagine what is going on behind closed doors in prison estates and across the justice sector, and especially given, like a lot of other key workers, you had to come into work throughout this pandemic, day in and day out, with all the dangers. So thank you for sharing this.
People, even beyond COVID, if I may, just quickly,
of course,
people don't understand we are just a big wall with another world behind it. And even out of COVID, people don't really understand what goes on. We are just seen as the, how can I put it, the forgotten army, as it were. We walk in through that door, our persona changes, we are then the authoritarian. But it's just with the help and community of definitely with Adrian and Chris, and as you know, been absolutely tremendous with that. And it's just a totally different world behind those walls.
Yeah. Thanks for that, Bob. Steph, I realized that directing this question to you would be a real challenge, because obviously for self-employed people, it's very difficult to group, and every person's life and work looks completely different. You've already mentioned the stresses that were caused by the uncertainties and insecurity of the government support schemes for the self-employed, but are there any other things that you think people that are in full-time employment or have never experienced self-employment wouldn't know about or be aware of in your work, in your life, and for other self-employed?
I think I noticed quite early on that people don't understand how the self-employed tax system works, which I can't blame them, because it's an incredibly boring subject. So sorry, I'm about to tell you about taxes. But yeah, the community, we ended up working together to launch a campaign called We Are the UK Self-Employed, because very early on, I started to hear lots of stories about self-employed people who were getting massive support from the government. They were getting really big grants, they were taking all this money, and they were still working and apparently not declaring it. But that, maybe there are some people doing that, but that's physically not how it works. The only way that I've just realized that, yes, the Tory cronyism was definitely doing that, but that's not who they meant. They meant builders, they meant maybe not accountants, but like nail technicians, those sorts of people. The way that they worked out what the self-employed support grant was for, this is only for people who are registered as sole traders. If you were a limited company director, that works an entirely different way as well. Was whatever you report every year for your self-report tax bill, they then took 3 years worth of that and averaged it out and said that that's what your average income was. Now, that has led to things like, on the extreme, there's been 3 million people that have been excluded from it, partly because they might be company directors, just other ways that they wouldn't have been able to be counted in that system. So those are the people that are being left out. But these stories that I heard of people getting all of this money and then still trading and making money off it, like on the sly, wouldn't work. Like, if they were making money on the side and not declaring it, they would have got no money, like, because of how it works. Then there was the this isn't my words, it always feels kind of rude, but it's not, the pregnant then screwed campaign. So women don't get, if I had had a baby in the last 3 years, I would have had to have taken a year off work, which means that there would have been a year's worth of my accounts missing. So they would have added up full year, missing year, full year, still divided it by 3. So you don't get the full amount of money. People think that we've been paid in a similar way to the furlough scheme, and we haven't. Just specifically with me, when this started, I'd been self-employed for, I think, 2.5 years. So I did have 3 years worth of accounts, but one of those years was half a year. So I'd only earned something like 5 grand or something, and they didn't count my paid employment prior to this. So they then divided it by 3, which essentially took out a year's worth of my income, and said that was what I actually earned, despite me having to pay all these bills and that not being what I earn. And my partner only had a year's worth. So they took his 1 year, divided it by 3, then said that's how much you live on every month, which was just absolutely not true. It's not the way it goes. And I don't think that people fully realize and appreciate that we don't get sick pay, we don't get holiday pay, you don't get maternity leave or paternity leave, and we pay our taxes the same way as people in employment, and we're just not treated the same. I think a lot of people think that all self-employed people are like millionaires owning big companies, but like, I've spent a year managing brewery social media from my back bedroom. Like, it's absolutely not the case. I've not got a secret pile of money somewhere. I've actually been done out of what I think should be rights in the UK. Everyone should have sick pay and decent sick pay, and everyone should have holiday pay. Yeah. So that, but I think that's true from hairdressers to builders as well. Like, it works the same. And then there's the bogus self-employed people who work for, say, delivery services, who have to go through all of these systems despite being employed by somebody, but they're not on paper. I think it's a very strange world of self-employment that people don't realize about until you get into it. And then you find out that everyone thinks you're a millionaire. Well, you're not.
Thanks for sharing this. And I think, I mean, on top of all the difficulties and hurdles that you've described for self-employed people before and during the pandemic, I think it's also an extra challenge when people have a wrong idea of what you are and the kind of life you lead. That must be so frustrating. I have a question for Rosanna, but just for everyone on this call, we're going to open it for questions after that. So please pop it in the chat, whatever it is you'd like to ask our panelists. Rosanna, my question for you is, currently you are the shadow cabinet minister for mental health. If tomorrow you've become the minister for mental health in the government, what would be your top 3 priorities?
Well, before going into my top 3 priorities, I would throw a huge party, because it would mean that the Labour Party were in government, which is something which would make me very happy. But in terms of my top 3 priorities going forward in this brief, I mean, before now, we had the Care for Carers package, which I put together with many unions to talk about supporting the mental health of the people who have been our frontline health and care staff throughout the pandemic. So I'd want to see that enacted immediately. But in terms of some of the priorities going forward, look, I want to live in a world where someone can call their employer and say, I'm really sorry, I can't come into work today. I'm feeling anxious, I'm feeling depressed, I think I'm drinking too much. And that really is about stigma. People would still much rather fake a migraine, fake a dodgy tummy after eating a takeaway, or have the flu than admit that they're struggling with their mental health. And stigma and dealing with the stigma surrounding talking about mental health is more than just warm words that we get from a lot of representatives, politicians and people in the media, celebrities. They talk a lot about stigma and alleviating stigma, but truly I think it's going to take a generation to do. And I think that comes with having things in the workplace, for example, like mandatory, and I haven't fleshed out what a policy might look like, but something like a mandatory mental health support system that businesses have to take on in order to support their staff. Normalizing talking about mental health, which also leads me on to another priority that I have, which is suicide, particularly suicide in men under 45. We know that the numbers are going up, and part of that is because of the stigma surrounding talking about mental health. People just don't feel as though they can go and get help, that they can talk about it freely. And for many groups in our society, people from lower socioeconomic groups, Black people, BAME people, their interaction with health professionals is often so negative that they don't get treated properly, which, and Bob will know this better than me, so many young Black men, the first time they're actually diagnosed with mental illness is when they've already entered the judicial system. It's too late then. We absolutely need to tackle the scourge of stigma, deal with the issue of suicide, because as far as I'm concerned, every single life lost to someone taking their own life is one that could have been saved. All of this comes from supporting our children and young people's mental health as well, and properly investing in CAMHS, child and adolescent mental health support. If we don't do this, if we don't get on top of this, we are letting an entire generation down. So those would be my priorities, understanding though that we will never really tackle the issue of mental ill health unless we deal with the inequalities in our society that are so entrenched within our society. We know that adverse childhood experiences are the single biggest driver of mental ill health. We know that if you live in substandard accommodation, your parents can't access work, you're from a domestic violence household, you haven't got access to proper education, you live in a one-bed mouldy flat of your 7 brothers and sisters, you are more likely to suffer with mental ill health. So I think the bigger picture has to be tackling the inequalities, not just in a health silo, but with education, housing, like Department of Work and Pensions, all of those departments. But on top of that, saying, well, where are we now? We've got to get on top of, suicide, stigma, child and adolescent mental health services. But that's not just from cradle to grave. Mental health affects people. My own father, recently passed away. He had dementia. As far as I'm concerned, it is about supporting our older people's mental health as well, understanding, pregnant mums and mums who've just given birth, and fathers, and how they can suffer with their mental health. So really, it's such a big topic, but the 3 that I would jump in on are the ones that I mentioned.
Thanks for that, and sorry to hear about your father passing away recently. I think, absolutely right that the mental health, even though this webinar is obviously under the headline of mental health, we definitely understand from hearing everyone's experience that it's not a standalone issue, and it's connected to so many other issues that affect our lives. And it's why I said at the start, we believe it's definitely a trade union issue as well. We've got a question from one of our self-employed members on the call, Liz, about the support that she can get as an employer. Liz, would you like to unmute yourself and just ask the question and say who from the panel you're directing it to?
I always feel like I have to stick up for employers at this point, because I don't get to phone in sick when I'm suffering from my anxiety. I'm looking after the mental health of me, my husband, my staff, and also my customers, because I run a pub. I've talked a customer out of taking their own life. I've done that. I've got a customer at the moment who's a veteran with extreme PTSD, and I have to support him. I've now got bereaved customers that are coming in and wanting to be with other people, and who do they talk to? Well, they talk to me. Because it's that thing, you can talk to your pub landlady about everything, because your pub landlady will keep her lips sealed. But where do I get support? Because I'm not a mental health professional. So, you know, where is that support for me when I find issues that I think this is more than a conversation that you need? And I've got staff like that, you know, as the presenter knows full well, you know, mental health is something I talk about with my staff quite a lot. But that's not the end of the problem for some of them. You know, there are problems that they've got that I can't just talk them out of, particularly at the moment when we're all, you know, running around trying to do table service and keep everyone safe, and, you know, extensions keep on going. Who knows when we're going to be back to profit again? Probably not till the end of the year. So, you know, what can we do to make sure that people like me that are desperately trying to do their best actually get the support that we need?
So it's a really, really good question, Liz. And it's a difficult one because obviously we have talked about how there are some gaps. Rosanna, are you okay to tackle the question?
Yeah, firstly, Liz is my hero. Liz and I are good friends, and I literally am in awe of her and how she has put her staff, her community, the people that, you know, come into her pub that she sees and treats as family first throughout this whole pandemic, and I know that has taken a toll in which it would on anyone. But it is absolutely right, you know, and I know Steph talked about it as well, the responsibility of being an employer. Like, where do you go? Where do you turn to? And I know Liz, she's fantastic to talk to, and she would, you know, do the very best that she could for people. But there are a lot of people who will have people open up to them and say things like, I want to take my own life, I don't know what to do, and may not know how to handle it. And Liz is saying that, you know, she often needs support. So imagine what it's like for people who this is completely new to them, and it shouldn't have to be their responsibility as well. Like, when you are an employer, you know, you're running a business, you don't automatically have mental health training. I mean, it's hard enough to have our teachers and our doctors have adequate mental health training, let alone being an employer. That's kind of not what you signed up for. But unfortunately, the way the world is now, it's something that people are having to deal with more and more, and the government absolutely has to put things in place to provide really positive signposting. So it should be that Liz should be able to provide specific tailor-made service provision in her local area that she could give to someone on a leaflet. Look, we know that so many people we see in hospitals, that we see in pubs, that we see in hairdressers are suffering with, you know, domestic violence, suffering with all manner of things. There should be a way in which people who face people every day in whatever capacity can provide people support. In the same way as in the hospital, we can give a lady a little number to put on a card in her bra, that, you know, that she can call if she's suffering from domestic violence. Liz should be able to have something available to her that she shouldn't have to seek out herself, that says, look, if somebody comes in and is feeling X, Y, or Z, if they are an employer or if they are a member of the public, here's where you can go for help. Also, here's where you can go for help if you're struggling with your own mental health. And unfortunately as well, you know, when we look at some of the toxic narrative that came out, so like some of the language that came out throughout the pandemic, I've done a lot of work with people in the beauty sector just because they reached out, and in the travel industry, where people were told, quite frankly, that they should retrain and get a better job by government ministers. What that did to their mental health, how that made them feel about their lives and their life choices and their livelihoods when they give back so much to the economy. I think on every level, government has to take into consideration employers. Absolutely, when it comes to their mental health, when it comes to their, you know, economic support, when it comes to their general well-being. And I think Liz is right. There isn't enough that's done to support employers, and there is that perception that, you know, Steph spoke about earlier, that if you have your own business, you must be just rolling in it. And I think, you know, we have a duty to amplify the messages that that's not the case, and it's a collective responsibility. And if people say, well, why is someone's mental health my problem? Well, because we all live together, we're all a society, we all want better for our brothers and our sisters and our friends and our neighbours and for ourselves, and we all have a duty to bring that about.
Thank you so much. That's a really, really good answer. Steph, I wondered if you wanted to just jump in with a couple of reflections as an employer yourself.
I think, as Rosanna said, like there's there needs to be adequate, I think it's a two-stage issue. There's the being an employer and supporting either your customers or your employees, which, yeah, like we need to be able to tackle the social issues that are causing these things. Then there needs to be adequate NHS health provisions, mental health provisions to sort this out. But that is completely separate to how we deal with it as an employer and a person. There needs to be some sort of mechanism that the employer can remember that you're a person and take some time off, and your entire business not crumble and disappear, and your staff not be like left in the lurch because you're not there. It's a much bigger argument than just how we provide mental health services as an employer. But I think one of the things with the self-employed support grant has shown that maybe some form of universal basic income would allow you to take time off. I don't think that's like the ultimate answer to these problems, because in the current economic system that we had, if we did implement a universal basic income, the economic value would eventually dribble back up to the 1% again. But there just needs to be some sort of, I think it needs political intervention, a way that allows us to have time off and remember that we are people. And then we would also need to go and access the NHS provisions, that kind of stuff. So sick pay to UBI, something in the middle, maybe. I can't solve the problem right now.
Yeah, we're not asking you to solve all the world's problems.
Yeah, I'll try.
Yeah. We've got about 8 minutes left, so I thought I'd just go to Bob with one final question, which is, as we come out of restrictions, as we know the world starts to go back to normal, obviously that doesn't mean that it's all over. How do you think people are going to feel? What's the situation going to be like as we leave the peak of the pandemic? Hopefully, if we do.
Bob, I think you're on mute.
Do apologise. I hate technology. That's my problem coming out of COVID, that little thing. It's a very good question. We've got in the last about 18, 19 months into the pandemic. And during that time, we have had 3 initial training courses of up to and including 65 brand new members. They're on the wings. They've never seen what I would call, and I've been in this job now 20 years, very shortly, and they've never seen a full cohort of 96 prisoners out on an evening on association. The one good thing is we are not going back to that. There will be 2 separate regimes running of approximately 46, 47 residents out at a time with 3 members of staff. They're going to struggle. There's absolutely no doubt about that, because at this moment in time, the bubbles are smaller, perhaps 15 residents at a time, 1 going out for exercise, 1 having association, and 1 bubble in the showers, obviously all socially distanced. They are worried. I have had comments made to me. I've had staff go, Bob, what happens when it goes to the normal? I can't tell them nobody can, what the new normal is going to be. But all we can do is offer them the support if they're feeling anxious, of which they are, there's no doubt about it. Fortunately, they haven't seen and gone through what the old sweats like myself have gone through. So I am grateful that community and Sodexo and themselves have got their heads together, and this is the plan that they came up with. So we will have far stricter control over the residents, and that's not us beating with a big stick. This is our employers accepting the fact that we cannot go back to how it used to be. Our new norm now is as it is at this moment, bearing in mind things are going to change. Visits have opened up again, so people are seeing families. Next week, we are opening up more workshops, so they'll be out of the cells in purposeful activity, of which gives my colleagues and members a break. You know, if they're not on the wing, they'll get that extra 20 minutes, half an hour to have a break, get time for a cup of coffee. Everybody's got their own coping mechanisms. Some sit and talk, some go quiet. All I've asked, and it was last week, anybody who thinks that they are suffering, or anybody who witnesses someone they think is suffering, and perhaps before it gets too bad, never be afraid to start that difficult conversation. Get into them. I'm here, my managers are here, my union's here behind me and them, and let's just make sure everybody is safe.
Thanks, Bob. I think that's a perfect note to finish on. Don't be afraid to have those difficult conversations. So over to Maya just to give some very brief closing remarks, I think.
Thanks, Anna, and thanks everyone for joining us, and especially our brilliant speakers, Rosanna, Steph, Bob. It's been kind of really diverse experiences from the pandemic and ideas of how we should move forward and what we should be calling for. I've also popped in the chat some resources that community offers to members from Mental Health First Aid to some courses. You can email our learn@community.org email address to learn more and take part. Thank you all again for joining us this afternoon. As Bob said, if there's anything that you'd like to talk about, difficult conversation, please get in touch. And we hope that on next time we'll have these webinars. We could see that some of the stuff that we've been calling for were already done, so we could move to the next step. Thank you all very much again, and bye for now. Thank you.
Thanks so much for having us. Thank you. Bye-bye.
Thank you. Bye.
Bye.
Bye-bye. Stay safe.